Hey everyone, it's Shelley Prosco here. I want to share a little bit about a course that I have coming up. It's called Integrating Yoga into Pelvic Pain Care, and I'm offering it over 2 Mondays. So the first Monday is May the 9th, and we will meet live online for 4 hours. And then you get a whole week to practice everything we've learned, and then we meet the following Monday, May the 16th, for another 4 hours live online. And this course is really for anybody who is interested, any health professional who is interested in integrating yoga principles and practices and the framework of yoga into their pelvic pain care. So if you are a pelvic health professional like a PT or an OT or other rehab professional, a yoga therapist or other yoga professional, a movement or fitness professional, and you really just want to learn more about how you can use these yoga principles and practices within your scope of practice and in line with what the current evidence is telling us about pain and pelvic pain and pain care, then I think you'll really appreciate and value this course. And here's some of what you can expect from our time together. So we will highlight key points that are essential for us clinicians to understand about pain, about pelvic pain care, and about people in pain and their lived experience of pelvic pain. And of course, we'll explore the yoga therapy framework that we use that's whole person centered and valued and offers this biopsychosocial spiritual model of care. And we'll explore a variety of yoga practices and principles that can help people help themselves, so they can use these at home, they can feel this sense of empowerment, improve their self-efficacy, and help them reduce their own pain or manage their own pain and help them move with more ease and also progress towards this more thriving type of a quality of life. And we'll do all this within your scope of practice as a professional, and that's in line with the evidence and the clinical best practice guidelines. And we'll have a combination of lectures, so I'll be presenting part of the time, and we'll also have group discussions and some breakout discussions. And of course, we will have the experience. So I will guide you all through different movement practices and yoga postures using different language and cueing so you can experience that. Language is very important here, and how we speak and what words we choose. And then we'll also experience a variety of different awareness practices, different breathing techniques, and of course, different mindful meditative practices. And then we'll have a look at some case studies, so then we can apply our clinical reasoning to integrate these yoga principles and practices within the context of pelvic pain care. So I created this course in response to the needs of the clinicians that work in pelvic pain care, as well as in response to the needs of the people who live with pelvic pain. More and more people are looking to yoga for solutions, whether it's because they're hearing that yoga is good or they're reading in the media that there's some research, and we've got growing, compelling research now that shows yoga can be safe and effective for people with chronic or persistent pain. Or people in pain, I think they're also hearing from their physicians, from other healthcare practitioners, that they should be doing yoga. So more and more healthcare providers are recommending yoga to their patients. So this course is to help you, the clinician, help meet those demands of your patients, or at least meet those curiosities. And then, of course, as I mentioned, I'm also responding to the needs of you as the clinician. A lot of pelvic health professionals out there that I've taught in some of my other courses as I teach integrating yoga into pelvic rehab and wellness care in general, and also integrating yoga into chronic pain care in general. But more of you are coming to me saying, I want something just more specific to pelvic pain. And so as I listen to more and more of the pelvic health professionals, sometimes you all will share with me that the internal pelvic floor work that you do, while can be extremely beneficial, it's not always appropriate for everyone, nor indicated or effective. And so looking at more tools, more options that aren't internally based. And that's the beauty of yoga, is that we have all of these different options that we can offer. And we know that pelvic pain is complex. And we know that we are told when we're trained, we are told that we have to take a whole person-centered biopsychosocial spiritual approach. We know this, yet we don't always have a lot of training as to what does that look like? What are the practices? How do we look at the whole person, their physiology and psychology and their spiritual concerns, and staying within our scope and in line with the evidence? So this course is intended to help you serve your clients even better than you already are. So I hope that you will consider joining us 2 days, May 9th, May 16th, 4 hours each day. Join us live online if you can. It's such a great experience to go through the practices, to be in community with everyone, to have these discussions and learn more about the science and the art of integrating yoga into pelvic pain care.